Good morning. I'm Diane Macedo. Thanks for streaming with us. In today's update, there is early evidence that a new COVID variant is spreading rapidly in New York City. Researchers say it appears the mutation is another, quote, variant of concern, like the UK, South African, and Brazilian variants. Now, vaccine makers are preparing new booster shots to combat new strains, as Johnson & Johnson is on the verge of becoming the third vaccine authorized in the U.S. The J&J vaccine is shown to be effective against variants. The FDA could give emergency use authorization as early as tomorrow night. Right now, more than 13% of the population has already gotten at least one vaccine dose. The LA sheriff is ruling out alcohol as investigators try to determine the cause of Tiger Woods' car crash. We're also getting a look at how safety features in the car he was driving may have saved his life. Meanwhile, a safety review was announced on Wednesday into the stretch of road where he crashed. Woods is recovering from multiple serious leg injuries at an LA hospital. And the latest jobs numbers show 730,000 people filed for unemployment last week. That's much better than analysts predicted, but it's still higher than any point before the pandemic. Meanwhile, the House is set to vote on President Biden's COVID relief plan tomorrow, setting up a critical vote in the Senate. Democrats want to get the bill to Biden's desk ahead of a March 14th deadline when unemployment benefits will run out for millions of Americans. And earlier this month, the CDC released highly anticipated guidelines on opening schools amid the COVID-19 pandemic. But that guidance has been met with some criticism, both from people who claim it is too strict and others who say it's too loose. Now case numbers are dropping, but more children are dealing with long-term COVID symptoms. So what do school administrators need to consider? Let's bring in Children's Hospital of Philadelphia Policy Lab Director, Dr. David Rubin, for more on this. Dr. Rubin, thanks for joining us. We know you're busy. We appreciate your time. Curious to know what your take is on the CDC's specific case number and test positivity rate thresholds for reopening schools.
Look, I'm going to say right off the bat, I think the CDC kind of got it right on this one. I think the guidelines, people have to remember the CDC is speaking on behalf of all schools around the country, from our large urban school districts down to our smaller private schools. So, a lot of the critiques have recognized that individual schools need to make their own choices informed by the evidence. And I think what the CDC provides are relative lane markers for how to think about when to return to full in-school instruction or when to reopen for those who haven't reopened. And I think it's the principles that matter most in that document, that being recognizing that as case incidence continues to fall here in the spring, a big window of opportunity is now opening to return more kids to the classroom. And for those who would critique that those thresholds are really conservative, I think we're seeing the kind of declines now that many schools are going to see themselves push right past those thresholds, and then we're going to get a lot more kids back to school.
And Dr. Rubin, the biggest point of contention that I've heard from school administrators is this recommendation of 6-foot distancing between children. Many say, one, it's just not doable. You can't bring all the kids back if you're going to try to force them to space out 6 feet because there's just not enough space in the schools. But also that other data has shown that 3 feet between children is sufficient. Do you think that 6 feet is totally necessary, particularly for the younger children?
Well, it depends on what's going on in community transmission rates. If there are more kids knocking at the door with COVID infection and you're really closely packing kids into a classroom, you potentially could get in trouble. And I think the CDC guidelines reflect that. Under a weekly case incidence of 50 cases per 100,000, they recommend full in-school instruction with 6 feet to, quote, the greatest extent possible. Now, to me, I interpret that to mean they recognize that you're going to have greater value in terms of preventing infections at 6 feet, but I think they've given enough flexibilities for schools to try to plan to use outdoor space as we go into spring, prioritize those opportunities to maximize 6-foot distancing, but they recognize that many schools are going to have to go underneath that barrier, but they're just saying, wait, you have a little patience here. We're seeing great declining case incidents right now, and your window of opportunity is opening. And for every school, they can look at that relative lane marker and decide, what their appetite for risk is as a school community, how well they've done in the fall. But I think the relative message there is we're getting there, and we recognize that we're going to have to break that 6-foot barrier.
And the other criticism that seems to be rising to the top is on ventilation. The fact that the CDC guidance barely mentions it, while some infectious disease specialists, that should have been number 2 behind masking. What do you think?
Well, our team actually agrees with what the CDC said on that. I think you have to recognize that throughout this pandemic, the basics of transmission and our knowledge of transmission has not changed. This is primarily a large droplet spread virus, which requires close proximity and sustained contact. It doesn't mean that under certain conditions and in the right environment, there might be some anecdotal cases of airborne transmission, but that is the exception rather than the rule. And if you acknowledge that, you recognize that ventilation, you make improvements to ventilation, but it is not a primary COVID prevention mechanism. Masking and distancing are your primary mechanisms in keeping sick kids out of school. So I applaud the CDC for recognizing that, because in some ways you can develop a paralysis thinking about ventilation as a key primary intervention, when in fact it's actually a secondary intervention among the ones that work the best.
And then the CDC did a case study of a school in Georgia and found that teachers may play more of a role in spreading COVID than children do. So how much can that be helped by vaccinating teachers, as long as this question still exists of how much vaccines actually prevent the spread of the virus?
Well, we know that the older youth, the adolescents and adults are principally those who are most likely to acquire and spread the infection. We've seen that throughout this pandemic. It's not anything unique to teachers, but it recognizes that, obviously vaccination of teachers is certainly going to help. But we've spent a lot of time advising school districts to be mindful of how teachers and their staff move through the school during the day. Be careful those break rooms when those masks come down and you have a cup of coffee with a friend. And then also recognize the value of testing, which was also recognized in the CDC guidelines as a way to provide sort of weekly assurance testing and focusing it on your staff to try to help prevent asymptomatic but contagious individuals from entering the school.
And then, Dr. Rubin, we're learning more about an uptick in multisystem inflammatory syndrome among children who had COVID, or severe symptoms in children with acute COVID. How worried should parents be, and when do you think children will be able to be vaccinated?
Look, we can't entirely eliminate all risk, but still today we have the same evidence from the spring that the significant complications in children are extremely rare. The MISC, which we have seen increase a bit here late in winter, similar to last spring, occurred about 6 to 8 weeks after the big peaks in late December and January. But we're seeing now national declines in pediatric hospitalizations. They just lag behind the adult declines, but still, the number of hospitalized children remains very small compared to what we've seen among adults. And with regards to vaccinations, I think we do recognize that children, and particularly older youth, contribute themselves to community transmission and do have the risk of these rare complications. We're doing vaccine trials, I think, down to age 12 at this point. I would suspect by the early fall, once we have the data that comes in from those trials, we're likely to see our older children and adolescents line up for vaccinations.
All right. Dr. Rubin, we appreciate your time today. Thank you.
You're welcome. Have a good day.
You too. And as vaccines roll out around the world to combat coronavirus, many in Europe are still skeptical of getting the shots. Some say this could lead to major cracks in the long-term strength of the EU and could potentially cause major hurdles in the global effort to contain the pandemic. James Longman has more.
There are feelings, and then there are facts.
And nobody knows what this vaccine contains.
I mean, you keep saying nobody knows.
How can we?
But with COVID-19, feelings often overwhelm the facts.
So what's quite clear is that people aren't really interested in having a debate. They just want to tell you what they think without listening to what you have to say.
At this small anti-vax protest in France, 30 or so people braved the cold with their false beliefs. But Europe's anti-vaxxers are just part of the reason Europe is lagging so far behind the United States in the race to vaccinate.
The government treats us like sheep. No, we have liberty. We can choose to wear the mask or not. We can choose to get the vaccine or not. It's my body. Nobody touches me.
A year ago, the EU was praised for the relative coordination of its pandemic response compared to the US. Locking down when needed, closing non-essential businesses and scaling back public events. Now there's anger and chaos facing its vaccination program. France is one of the most vaccine-skeptic nations in the world. In January, one poll said only 56% of people said they'd get the vaccine. The French have a long history of distrusting the state. We saw it firsthand when we spoke to people at this market in northern France.
French people in general are weary.
The fact that we produce this in record time, we ask ourselves if it's effective, if there won't be too many side effects.
But France was once an immunization pioneer, creating the shots that protect against tuberculosis and rabies. And when the renowned Pasteur Institute abandoned finding a COVID-19 vaccine, it was seen as a national embarrassment. Right now, 4.9% of people in France have received the first dose of the COVID-19 vaccine. In Germany, it's around 4.8%. Those numbers pale in comparison to those of the UK, where about 25% of people have already received their first jab.
I think everybody who's been involved in the vaccination program can be incredibly proud of what has been achieved.
Britain, freshly Brexited from the EU, ordered the AstraZeneca vaccine 3 months before the European Union. And even though Britain didn't need Brexit to get their doses, since technically each country could have ordered their own, it's made Brexit look good. Despite Britain having one of the highest death rates per capita in the world. The botched EU rollout has put the main EU powers on the defensive.
I fully support the European approach that we've had because we should not vaccinate one country over another.
So why was Europe so slow? It's a question of risk. The UK was prepared to pay more and take more of a risk with liabilities. The EU wasn't. Brussels also wanted all 27 member states to act together, a painfully slow process. Brussels is now playing catch-up, waiting on AstraZeneca to deliver the promised doses while battling a hesitant public. And even though Europe's medical agency gave AstraZeneca the green light, many European countries said there wasn't enough data to prove it worked in the over 65s. Public confidence further eroded.
The most common points are the fear of adverse effect, the idea that it is better to let nature take its course, and the idea that there is a collision between pharmaceutical companies and health authorities. The refusal of a vaccine should be interpreted also and above all by a posture of individual freedoms defenses. And I think in France we have historically fought for the state not to interfere in our privacy.
And there's another serious dynamic at play.
Is populism on the rise in France? Is that why, do you think?
Yes, the rise of anti-vaccine movements in Europe and in France is linked to the rise of populism speeches.
Hungary, currently seeing a worrying tilt to the far right and a clampdown on free press, is going its own way, ordering Russian and Chinese vaccines. Other populist movements from Italy to France have gained politically. This vaccine chaos is testing the very fabric of a united Europe. James Longman, ABC News Live, Paris.
And our thanks to James for that report. Now to Tiger Woods and the new details on the car he was driving when he rolled off an LA highway on Tuesday. Experts now say certain safety features in the car may have saved his life. ABC's transportation correspondent Gio Benitez has a closer look.
This morning, as investigators search for answers in Tiger Woods' horrifying crash, attention now turning to the car he was driving. The new luxury SUV by Hyundai, the Genesis GV80, had already received early critical acclaim. But now experts are pointing to its unique design and airbag positioning. This morning, GMA getting an exclusive look at crash tests underway right now by the Insurance Institute for Highway Safety. Here, you see one of the rare features, an airbag between the two front seats, one of the 10 airbags in this car.
Airbags deployed, all of that. And however, thankfully, the interior was more or less intact, which kind of gave him the cushion to survive.
Woods sustained injuries to his legs, but apparently not to his head or torso.
The vehicle is designed in such a way that the front end of the vehicle absorbs a lot of the energy of a crash.
Then there's what Genesis calls its reinforced passenger compartment. Here, the IIHS conducts its roof strength test. The roof seems to hold up. But it's not the only car getting high marks. The IIHS now releasing a list of 90 top safety picks, which provide good protection in crashes, sufficient lighting from headlights, and effective front crash prevention. From the Honda Insight and Accord to the Mazda CX-3 to the Ford Explorer and several other Genesis models, the Genesis GV80 is still undergoing those tests.
We expect that when we release the final results for this vehicle next month, that it will be an award-winning vehicle in our eyes and receive the top safety pick or top safety pick plus designation.
So what should you look for when you're buying a new car?
If you're going out to the car dealership, the top 5 safety features that you should look for are automatic emergency braking, forward collision warning, blind spot warning, rear cross traffic alert. And this isn't a safety feature, but definitely check the crash tests.
By September 2022, all new vehicles will come with automatic emergency braking, a feature on the GV80, and many already come with assisted driving features. And you've got to remember, those assisted driving features, they're phenomenal, but they're just that, to assist. They are not meant to replace the driver. And at the end of the day, this is the most important safety feature, the seatbelt. You gotta wear it. Diane?
Good advice, Gio. Thank you. And when we come back, our own Lindsay Davis joins me live to talk about her new children's book and how she's paving the way for a new generation of journalists. We'll be right back. Welcome back. I am very excited to introduce our next guest and her latest brilliant accomplishment. The new children's book, Stay This Way Forever, is a beautiful love letter to our children and a favorite in my own household. So I'm happy to be joined by Emmy Award winner, New York Times bestselling author, and a member of our ABC News Live family, ABC News Live Prime anchor, Lindsay Davis. Lindsay, welcome. I'm so excited to talk to you about this book because I know I told you this already, but I literally teared up the first time I read this to my son because I felt like it really encapsulated the way I feel about him right now, which is sometimes I just kind of want to freeze him. I want to freeze these moments that I have with him, and I want him to stay this way forever. And that's exactly the sentiment that comes from this book.
Well, I'm so glad. First of all, thank you for having me on the show, Diane. But I'm so glad that you're having this reaction because, well, what's funny is, you know, writing a book, it's a long process, especially when it's illustrated. So I had written it. The manuscript was approved. Months go by. And then they mailed it to me. And I was reading it to my husband and son, and I cried. And I thought, oh, my goodness. And now we're starting to get so much feedback from parents who are saying that they teared up and that they're emotional about it. I think that so many parents can relate to this, that you kind of want to press the pause button and just savor these moments. And there are so many things that you know that are fleeting about childhood. But then there are those other aspects that you really hope that they're going to carry with them into adulthood, their curiosity and creativity and passion for life. I know that my son, many times when we're going to bed, he'll say, tomorrow's going to be the best day ever. And I hope that he keeps that with him, you know, that the possibility of tomorrow or something to be so excited about.
Yeah, we want them to learn from us, but in so many ways, we kind of want to remember to learn from them, too, in that spirit. Now, my son's 2, so, you know, he appreciates it for many different reasons, particularly the beautiful illustrations, which are so well done. But your son is 7. How is it to relay this story to him, and how much influence did he have on this book?
Oh, he is the entire inspiration of this book and really my muse for all of the children's books. And he sees himself in the books as far as, like, this is pretty much like taken exactly out of our home
showing him on the screen
and
right
our
now.
life. Oh, there he is. And really what was happening at the end of the day, I was kind of writing down specific moments about, like, hearing the pitter patter of his feet in the morning, and before he jumps into bed with us, and you know, the certain way that he kind of squeals when he laughs, and just, like, you know, all these moments that I know that all parents have and really savor and embrace. So this is directly taken out of our life. And my son now, what I find so cute, he'll take a stack of white papers and staple it and draw his own pictures and write like a line. And he's like, Mommy, I wrote a book just like you. And so it's fun that he's getting in on the whole process.
And I want to show you, just so viewers at home know they don't have to take my word for it, I want to show you a little clip of what generally happens every single night at our house now. Take a look.
Story.
You want a story?
Yeah.
Okay, which book do you want?
Story.
Do you want the puppy book?
The story. New book.
The new book?
Yeah.
This one?
Yeah.
Okay, the new book it is. Every night. So he does actually now say the title, or at least I understand that it's the title. Most other people wouldn't. But still, we've had it for weeks now, and every single night, this is the book that he wants to read. So that, that's the review that carries the most.
I love it. I love it. And I love your reaction too, because you're like, again, every
here
night.
we go. Well, the other thing about with all your books is they depict kids of all different races and colors. And in this particular case, it is a family of color that you're portraying. And yet this book doesn't feel like it's only for families of color. How important is it for you to be introducing this, this diversity to kids at such a young age, and hopefully for families of all different races?
It's so important. And it's funny because initially when I started writing books, it was so that my son would have the reflection of himself in the pages, that he would see images in kids who looked like him. And I read an essay years ago, and it was called Mirrors, Windows, and Sliding Glass Doors. And I found this is so profound because now I'm not just trying to affect the mirror image, but the window for other children to be able to peer into a world that might be unfamiliar from their own. So this is not just, the outside and what it looks like, urban versus suburban. This is just introduction to children. Maybe you live in an area where that's not very diverse, and so your kids don't come into contact with kids who don't look like them. And so books and toys would be a really easy introduction to get kids familiar, because I think so often we fear what we don't know. And especially coming off of the so-called racial reckoning and the summer of protests that we have, and parents were saying, what can we do? What kind of conversations should we have? And I think that this is a way, just, look at your own bookshelves. And this is kind of my diversity challenge. And see, beyond, a snowy day, do you have any books that look different from your own child? And I think that parents need to kind of widen that view for their children. And again, you can start with books.
And the books really, they celebrate the differences, but they also point out what these kids all have in common, the spirit in our children. They're building rocket ships, and they're talking about castles and unicorns, the same any kid does. So you really do this in a beautiful way. Now, this is your third children's book. So what's next?
It's so interesting. I kind of started this as it was going to be a one-off, and it was really kind of, I really feel that I want to do this. I feel like I should do this just to kind of increase diversity in books. And now they've really taken off and become bestsellers. This new one is now a bestseller on Amazon in the top 10 yesterday. And so I'm just thrilled that the message is really resonating. And some more books to come.
We sure hope so. I can't let you go without congratulating you on your new role to the anchor of World News Tonight Sunday. Now, you're the first Black woman to anchor a primetime ABC News show in 18 years. So what do you say to future generations, some who may be reading this book, who have big dreams of following in your footsteps?
Well, I have to, and I do every time, pay homage to Carol Simpson, because she was the first in 1988. She became the first Black woman to anchor any network newscast, not just here at ABC. And so I'm so grateful for those pioneers and trailblazers, people who didn't let no or can't or not seeing an example keep them from pursuing their dream and whatever their desire is. And so I would just encourage anyone who's out there and you say, I want to be this. Even if that person doesn't exist who looks like you, go ahead and blaze your own trail.
Well, you're walking it, you're living it, and we love you for it. Lindsay, thank you so much for being here. Stay This Way Forever is available now. Highly recommend.
Thank you so much, Diane.
And that does it for this ABC News Live update. I'm Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. I'll see you back here at 3 p.m. Eastern with Terry Moran for The Breakdown.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.